This meeting is being broadcast live on YouTube, and it will be archived so that you can view it later. I've received apologies from Jean Knight, and Glyn Edwards is here substituting. Thank you. John Wilson is unavoidably in another meeting at the moment, but hopes to be here later. Do we have any other apologies? Okay, thank you. We go on to item 1, minutes of the last meeting, pages 3 to 10. I propose that the minutes of the meeting held on the 23rd of May 2024 are taken as read, confirmed and signed. Is everyone in agreement? Thank you. Do any members have any interests they wish to declare in respect of any items on the agenda? None, thank you. Next, we have my position statement. Copies have been emailed to you and a version's also published on the Council's website. I think it highlights the large demand there is throughout the system. And I would like to say at this particular time of year that vaccination is really important. A lot of the diseases that these protect against are respiratory viruses that, you know, over the winter months when it's very cold and wet, we don't want people getting seriously ill. So I would ask people to consider getting their vaccinations. And I'd also like to take the opportunity to encourage people to use Pharmacy First and 111 GP's out of hours health provision where it's sensible to do so. Obviously, if it is life-threatening, you know, A&E, but with all the pressures on the system, it would really help. Does anybody else have anything else they wish to comment about or ask about in my position statement? No? Thank you. Oh, one of the other things I'd also like to say, well, as we're in public, is that with winter fuel payments issue, please could I ask anyone who is having problems and difficulties to please alert us and try and apply for your pension credit if you're eligible. It's really important that we protect our residents throughout the winter. Thank you. We'll move on to item 5. Sorry. Oh, yes, Mike.
Yeah, so sorry, Chair, a bit late in. I was just the point in the briefing note about WorkWell, the WorkWell initiative. See, it's down to start on 1st of October, and I know it will come to the Health and Wellbeing Board in due course. I just wonder if it's worthwhile maybe asking Louise to do a circulation to the Health and Wellbeing Board just in terms of where we're at to it. I mean, I presume it's going to start, but I think the board being aware of how it's going to work would be useful in advance of that.
You note that, Akil, please. Thank you. Right, there's nothing else. We'll move on to item 5, which is the gambling related harms needs assessment. The report provides the Health and Wellbeing Board with an overview of gambling related harms, the impacts on health and an update on efforts being progressed by partners coordinated by Public Health to tackle and reduce the health related harms. We have Jo Hewitt and Victoria Rice from the County Council who will present the report. Thank you.
Thank you, Chair. Yeah, thank you. Thanks all for including this item on the agenda today. A partnership response to gambling harms has driven this work forward, and the health needs assessment included in the agenda pack is a culmination of that work, but also a starting point. We intend today to provide an overview of the journey that we've been on, the local picture and next steps. So I'm also supported, as Chair's stated, by Victoria Rice from our business intelligence team. So traditionally, gambling is an activity where someone risks something of worth. There's an element of randomness or chance, and the purpose is to win. Methods that are considered gambling are there on the screen and are included in the definition within the legislation. Gaming or the playing of games such as fruit machines or card games. There's betting, so that's horse racers, football accumulators, other supporting events, and also participating in lotteries. The definitions and legislation is contained within the Gambling Act of 2005 that also established the Gambling Commission. So that's the organisation that regulates gambling at a national level and also provides guidance and works in partnership with our local licensing authorities who are responsible for managing gambling premises locally. The Gambling Commission also regulates remote or online gambling, and gambling websites which trade or advertise to customers in Great Britain must also have a Gambling Commission licence. There has, however, been an explosion of technological changes since 2005, and the Department for Culture, Media and Sport, as the government department responsible for setting gambling policy, published a white paper in April of last year under the previous government to review the Gambling Act. A number of areas included in the review are currently on hold as we're waiting the incoming government's next steps. So approximately half of the UK adult population participate in gambling activity, and although it is age restricted, a quarter of our 11 to 17-year-olds also report spending their own money on gambling. There is increasing awareness of addiction and harm, recognised now as a public health concern. Gambling at this level, at a harmful level, is measured through screening tools, also used in national health surveys. A widely used tool is the Problem Gambling Severity Index. Answers provide a score, an indication of gambling risk, from low risk through to problematic gambling. Problematic gambling is still referred to in the literature and through the screening process. However, as understanding develops as we learn and grow in this field, and we're also starting to learn more about the impact of terminology. So we're starting to use the phrase such as harmful gambling, gambling at harmful levels now. The most widely used definition of harmful gambling is someone who experiences adverse consequences from their gambling. In 2021, Public Health England published a review into gambling harms and summarised those on the screen on your right. The adverse impacts impact the health and well-being of individuals, families, communities and society. These harms impact on relationships, health, employment, debt, crime and deterioration of physical and mental health. And at its worst, gambling can contribute to loss of life through suicide, now recognised in the National Suicide Prevention Strategy. Gambling disorder is recognised as a health-harming addictive behaviour, and the NHS long-term plan and NHS mental health implementation plan commit to further investment in specialist gambling clinics, and our East Midlands service was launched last year. In 2023, the Office for Health Improvement in Disparities produced an updated report on the economic and social cost of harms associated with gambling in England, and evidence suggests that these costs to local authorities are estimated, together with the societal value of health impacts, at £1.05 to £1.77 billion annually. So just to provide some local context from the information that we've gathered through the health needs assessment process, the table on the left there shows 2023 Gambling Commission survey data, and we've applied that to the census population estimates, and the screening tool that's used is the Problem Gambling Severity Index that I briefly mentioned. So nationally, it's estimated from the survey data that 1.2% of our adult population are considered moderate risk gamblers, estimated at just over 7,000 of our residents in Leicestershire. 0.3% of the population are estimated as experiencing this problem gambling and harmful gambling, and this equates to approximately 1,700 people in Leicestershire. But we know that gambling at this level impacts the individual, families and communities, so it's estimated for each one of these individuals, a further 6 to 10 other people are impacted. So when we apply that to our population, this begins to scale up this figure to between 10,500 to over 17,500 residents. And this is also supported by recent research produced by the Office of Health Improvement in Disparities, who suggest in Leicestershire that over 18,000 residents might benefit from gambling treatment and support, and over 9,500 of our children will live in these homes. There is a national issue with local data regarding gambling, and there's a number of reasons for that. So there's lack of services available, secretive nature of the behaviour, and often national data is used and aligned with our census populations. And increasing local data is one of our partnership goals moving forward. So we know that anyone exposed to gambling products is at risk of experiencing the harms. However, there are populations more vulnerable to these harms associated with gambling, and inequalities in the extent to which populations are affected. So there's increased risk in vulnerable communities already experiencing inequalities. An individual's risk to harms is determined by their disclosure of the frequency of gambling and the impact of gambling on their life. But the data suggests that males, 16 to 24-year-olds, and individuals from our ethnic minority groups are more likely to experience gambling harms. And children are also considered an at-risk group. So although, like adults, most children are not experiencing the harms from gambling, there are concerns about the impact of gambling on young people's mental health and well-being. Children are considered vulnerable due to their age, and the Gambling Commission's Children's Survey has shown that nationally an estimated 0.7% of children themselves are gambling at harmful levels. So this estimate is estimated to be affecting 395 of our children in Leicestershire. And the children's screening questions are slightly different and include flex for that audience. So ask questions such as, have you spent your own money on playing cards? So we know that gambling harms has an impact on families when considering housing, finances, family breakdowns, and the impact of suicide. So further local research is required into these links, but also into the links with gaming and gambling and young people, which research is highlighting an increasing concern. However, these risks of experiencing harms from gambling, they're influenced by other characteristics beyond age and ethnicity and gender. So those in employment are more likely to gamble. However, those who experience problem gambling have higher rates of unemployment, and we see a similar theme with mental health. So those with poor mental health are less likely to gamble. However, those experiencing harmful gambling are more likely to have poor mental health. Research has found that veterans are 10 times more likely to experience these harms than our non-veteran communities. And those experiencing homelessness are identified as a vulnerable group who are also at risk of comorbid health issues such as mental health and substance addictions. Although those experiencing lower socioeconomic deprivation are less likely to gamble, they are more likely to experience problem gambling. And in Leicestershire, more gambling premises are in the most deprived areas. The Health Foundation has recently suggested that those who live near to a betting premise have shorter life expectancies. So a stark reminder of the link to inequality of the harms associated with gambling. Research also suggests that our sports fans gamble more frequently than non-fans. Young men engage more with sports betting, with gambling being a normalised part of being a sports fan. And there are concerns about online sports and gambling being a gateway to gambling-related harms. The Office of Health Improvement and Disparities produced a needs assessment in 2022 and proposed a number of recommendations for local authorities in regards to exploring gambling harms, to understand who is experiencing these harms, how and what can be done to prevent them. And we're feeding through a number of those elements within our health needs assessment and subsequent recommendations. So a number of partners, including from our departments of children and families, adults and communities, our health partners, ICB, the VCS, our OPCC colleagues and district colleagues, suicide prevention and mental health, amongst others, have worked together to help shape the health needs assessment. We've considered who is at risk, level of need across Leicestershire, and impact on current services. There is not a specific responsibility on local authorities or partners to provide treatment or support. However, the NHS have made a commitment through the long-term plan. And as I say, the NHS East Midlands Gambling Harms Service was launched last year, and they are also part of the partnership group that's developed the health needs assessment. Unmet needs, gaps in provision and recommendations are developed within the parameters of no current funding stream, together with no one organisation having the ability to solve this. The partnership working group has been supportive and proactive in developing the needs assessment. We've shaped the health needs assessment produced as a framework for partners and organisations across the life course. The recommendations have been grouped into the 5 areas and are further detailed in the health needs assessment. Just to summarise, there's screening and data collection. So to ensure appropriate and timely support and to build the evidence base in Leicestershire, it is recommended that opportunities for screening are identified and monitoring and recording processes are established, and also to consider including in future health improvement service specifications. Through training, education and reducing stigma, we want to explore the current training offers and opportunities to raise awareness of gambling harms, along with working with colleagues across a variety of areas to tackle stigma and to encourage partners across the system to adopt a health in all policies approach. Through harm prevention, there are a number of recommendations, including working with our education partners, within families, with our district partners for the placement and location of gambling premises, and also to work with our suicide prevention partners to include in the LLR suicide prevention strategy. And through collaboration, this covers our links again with our licensing authorities, and also to explore our opportunities for continuing involvement with our experts by experience. And within our further exploration recommendation, we want to support the National Suicide Prevention 5-year strategy to better understand suicide rates in people experiencing gambling harms, and also further explore those at-risk communities, including the links between young people and gaming and gambling. We have motivation and appetite from partners. The working group is ready to transition into a delivery and implementation group. Our experts by experience have been involved in the shaping of the health needs assessment through the Suicide Prevention Lived Experience Network. Engagement with veterans is planned, with plans to further strengthen co-production. We've been fortunate to present a variety of partnerships and boards, including the Civil and Military Partnership Board, Children and Families Partnership, and also further plans with our social prescriber networks, and we're linked obviously with the First Contact Plus team. And this item is also on the agenda at the Staying Healthy Partnership, the Leicestershire Mental Health Group, and also the Suicide Audit Prevention Group. And there have been amendments to the Healthy Conversation Skills Training, inclusion of screening questions in the Healthy Workplaces Needs Assessment, discussions with our youth justice colleagues regarding assessments, and commitment to include gambling as an at-risk group in the LLR suicide prevention strategy. So our licensing colleagues have been supportive of developing the HNA as responsible for gambling premises, and public health are now part of the conversation around local statement of licensing policies. So once again, thank you. Thank you for including gambling harms on the agenda for today. Hopefully that provided you with an overview of the journey so far, and you're able to support us in taking these recommendations to the next phase.
Thank you, Jo. A lot of work has been done already, I think, through that. Thank you very much. Could I ask you to turn your mic on? Thank you. Does anybody have anything they would like to ask or any comments? Mike?
Yeah, thank you, Chair, and thank you, Jo. That was good. So one comment, one question. I guess in terms of support from the Health and Wellbeing Board, are you looking for the Health and Wellbeing Board to own this? Because I guess from a public health point of view, we kicked it off because I was going to say, for me, it's all part of addictive behaviour alongside drink and drugs and, you know, everything else. So it's important we do something in public health terms, but the way you've talked about it, the kind of the reach and the number of things it's involved in, you know, that multi-agency partnership, it's not just going, yeah, great, we need multi-agency approach, crack on with it. You're looking for us to ask you to come back, tell us how you're getting on, maybe do a bit of ownership and do all that kind of a thing. And then actually around addictive behaviour, I was going to ask, I might have missed it, we got anything in terms of how addictive behaviours overlap? So if you, you know what I mean? So if you're gambling, you're more likely to be drinking to excess as well. Was that in there or did I miss it?
Yeah, thanks, Mike. Yes, so we do know that consumption of alcohol, as that increases, so does the likelihood of gambling, particularly if you're already gambling at harmful levels. So there are those overlaps there. There is also a need. The reach is very broad with gambling harms. I think as we touched on, the harms will touch on all of Health and Wellbeing Board partners and work, and that's, so it's really important that we have this platform, that we're able to raise awareness of what we're doing. I think the working group is very representative of this group, and will transition then into a delivery implementation group for the health needs assessment, and happily come back to report in terms of how that progress is going.
And working groups will be owned by the Health and Wellbeing Board, if you like. Is that what you would want?
I think for a health needs assessment, we would have the working group as a standalone group, as a standalone working group. I mean, I'll be certainly led in terms of from the board if that's something that we'd want to have owned by the Health and Wellbeing Board.
I think it would be sensible, because all the needs assessments you usually come through this way. So I think it would be sensible, Jo, to do that. Yeah.
So, sorry, Chair, I suppose that's the difference, isn't it? The joint strategic needs assessments start off as a kind of Health and Wellbeing Board owned product, which we take forward. This one, I'm just aware, kind of started with public health. It's then involved partners. And maybe I should have been more explicit. Yeah, ideally, in my mind, I'd want to drag that into a kind of more of a JSNA chapter, I'm feeling.
Okay, it likes Mike's finger, it doesn't like mine. Just curious about the relationship between this work and a relationship between the Children and Young People's Partnership and also mental health and learning disability forums, thinking about those individuals who are perhaps most vulnerable and most influenced in terms of these behaviours. Have you had time and space within those forums, or are you planning it?
Thank you. Yes, so the health needs assessment was presented at the Children and Families Partnership Board over the summer, which is when we've considered children being as an at-risk group. I think it's really important, and children and families are represented on the group. On the working group as well. And we also have our mental health colleagues included in the working group and progressing conversations there and happily explore others. I think once we're now kind of at that development stage, we want to also review our membership. Where else do we need to grow and progress? Where are we not already that we need to be? So happily take suggestions for who else would want to be part of those conversations. But it certainly does overlap with all of those areas and certainly plans and objectives, particularly when we're looking at vulnerabilities, when we're looking at our children and young people, our families, our adults. You know, there's so many crossovers and overlaps. And I think that's how we've written the recommendations as a framework for partners to look at and consider actually where are we already having those reachable moments with people, or what is there any further action that we could do to certainly start to ask questions in a different way, or certainly start to seek that information that people might not necessarily disclose themselves. So as the more people that we can have those discussions with, I think the better.
Yes, Neil. Yep, Nicola.
Thank you both. Really good presentation, and I thought it was a very interesting read. There are some really interesting points as well within the document as well. I guess my question is, although from the Health Wellbeing Board, I guess we can support and kind of only do so much. I think my question is, do we know what is likely to come down nationally, and actually what is the Gambling Commission's stance on, I guess, with the voluntary contribution, which I believe is 0.1% of net revenue, which seems like a drop in the ocean compared to the profits that the gambling organisation make. And also there was a comment or a statement in the document where it says football teams will stop having gambling companies on their shirt, but actually there will still be adverts on the board and TV adverts. You know, is there commitment from the Gambling Commission to actually, I guess, support what we are asked to kind of do as a Health and Wellbeing Board? Are they looking to kind of pursue or, you know, do what they did to the smoking industry, where they stopped advertising on sport and TV altogether?
Yeah, thank you. And that's certainly the focus of the review. So the white paper that was produced last year under the previous government certainly covers the statutory levy on education, treatment and support. So currently there is that voluntary levy on our gambling industry to provide that funding that goes through certain organisations. And one of those key areas of that white paper was to look at making that a statutory obligation to ensure that we can increase transparency and sustainability of that funding. As it stands, we're waiting on the incoming government to decide on their next steps with the white paper. But there is certainly a growing concern and push nationally in regards to how are we supported in the decisions that we're making locally.
Apologies for being late, but we did say we would be. I noticed you said something about this going perhaps towards the children's thing, but do you think gambling usually affects adults? So does anything ought to go to the adults scrutiny board to let them know what we're doing? I apologise I wasn't here at the beginning, but got tied up with another meeting. So I think perhaps something ought to go to the adults to let them know what we're doing if we're thinking of doing something with the children.
Yeah, thank you. Yes, absolutely. Yeah. In terms of presenting at various partnership boards, we remain in the infancy in terms of our progress with this. So we'll happily take suggestions of where we can present and increase the awareness and also support for our recommendations and next steps. Yes, we have a very, in terms of our at-risk groups, in terms of our males and our 16 to 24-year-olds, in terms of our adults, that would certainly cross over with that suggestion. So thank you.
Mike, thank you.
Yeah, I think this is a good question, actually, isn't it? It's probably more a case for me of going away and working up that action plan. But then you're right, Mrs. Radford. I think there's a number of places we'd probably want the action plan to be presented and scrutinised. So adults and children scrutiny, health scrutiny. I'm also thinking some of the broader partnership meetings around community safety, looking at Jane, just because of gambling related sort of violence and stuff as well. So maybe if we get a bit more detail on the actions and then think where that can be properly scrutinised as opposed to the topic being scrutinised.
About it being scrutinised, think about how we can support you going forward on something like this, because it's very important and it affects the whole family, doesn't it?
Thank you. Anyone else? Okay, thank you. The board has been asked to support the findings and recommendations of the Gambling Harms HNA, and that we support the approach to transform the partnership working group into a partnership delivery group to take forward the recommendations. Are we all okay with that? Thank you. And I think if we can have you back at some point to let us know the actions going forward. Thank you. Thanks for your time. If everyone's in agreement, we're just going to vary the order of business from that set out in the agenda and bring forward the pharmaceutical needs assessment 2025 approach and governance. This is pages 131 to 138. This report provides the board of the likely timescales for the development and publication of the new Leicestershire pharmaceutical needs assessment for 2025, and to seek approval of the proposed approach, timescale and governance. Hannah Blackledge from the County Council will present this report. Thank you.
Thank you very much. This is just a verbal note to the board as to basically just to inform about the planned timescales and the necessity of developing the pharmaceutical needs assessment and what is planned and what the timescales are, and also consult on the governance arrangements. Basically, a few words of the background. The PNA is a statutory responsibility since 2012 Health and Social Care Act. And it has a 3-year lifespan. The last one was in 2022, so we're due now for one to be published in 2025. The purpose of the pharmaceutical needs assessment is to identify the services existing, whether there are any gaps in provision, through that inform planning and commissioning, and also inform the decisions in response to new applications for new services. There are some changes since last round of the PNA, in that the most likely, although in the document we say we're awaiting national guidance in October, there is through the grapevine there is no new guidelines coming, so we use the old one plus all the legal documents around it. So there'll probably be a little bit of a scope for changing the scope of the document. There are some minimal requirements, and there is also a slight change in that since last round that there'll be less of the national data available, so there'll be probably more work to be involved in collecting through local sources. The report that you've been emailed sort of outlines the proposed governance via the LLR joint reference group, which it's actually because of the draft references in your Appendix 2. It is based on the previous one for 2022, updated obviously for organizational and personnel changes that happened since then. Obviously this is a very first draft, so if there are any, we're quite happy to amend it and change it if you feel that's necessary. Although the governance group will be LLR wide, there are 3 separate documents for Rutland, Leicester, and Leicestershire, with support for the development coming from us for Leicestershire and Rutland, and from the Leicester Public Health team, obviously, for the Leicester document. In terms of the work plan and timescales, there are some fixed dates to be observed, which is the final publication is due on the 1st of October 2025, and there is a statutory consultation throughout June and July, and then apart from that, we have some flexibility of developing that timescale. The actual timeline is in Appendix 1. We have an option to present the pre-consultation draft to this board. It's in end of May to the end of May board. This will include by then all the data and analysis and the result of the surveys that are to take place through spring of 2025. And there are 2 surveys planned. One is survey of the service users, and the other one of the professional survey as well. So I'm sort of going back, but that's because of the flexibility of the November and December will be for the data collection and sort of initially for the final agreement on the reference group, and first meeting the reference group is to meet 5 times through the development of the P&A. So by May, basically the data, the only thing outstanding then is the two-month consultation. So in terms of the resource implications, obviously Leicestershire Public Health and Business Intelligence are going to be delivering for Leicestershire document, and also Rutland, and the P&A subject to equality impact assessment, which will be carried out as well. So that is in brief, and we basically it is just for information at this stage. So. Thank you very much. Any questions?
Thank you, Hannah. Anybody any questions? Yes, Gemma.
Thank you, Chair. Not really a question, more of a comment. I think it'd be really good if Health Watch could be involved in some of the work when seeking views of some of the service users. Health Watch England released some data today around some information around pharmacy closures and the impact that's having locally in Leicester and Leicestershire, as well as nationally. So I think it'd be really good because it's something we've talked about within local Health Watch around pharmacies and the changes. So I think it'd be something that we'd really be keen to be involved in next year. Sure. To support that, getting out there, particularly in those rural communities and talking to people.
Mike?
Yeah, thank you. And thanks, Hannah. Nothing on the process. I guess the thing for me is I just want this to be something that gets used. You know, it is a statutory duty that the Health and Wellbeing Board produces the P&A. We've been through this process before. I know it's you, colleagues in Public Health and DBI that do the legwork on this one, but it's a Health and Wellbeing Board product. I am not convinced in the past that sort of NHS England as the overseers, if you like, back then of pharmacy of never aware if they've used it or not. So I don't know if it's a question, but maybe it chimes with Gemma. I think if we can make it useful to the public, if we can make it useful to local commissioners of pharmacy as well, which I'm hopeful the P&A reference group would do by having the right membership, then I'd like to see this one as being something where we do have a visible sense of it being used to shape pharmacy. So it's a plea, really. Not your plea to take away and do, but I guess one for all of us.
Rashna?
I guess it's my plea to take away then, actually. So thank you. And this is incredibly useful. And I think we've got a pharmacy, optometry and dental group now set up as we've taken over the commissioning this year. So if we can feed it formally through that and make sure we've got a route back through this governance process, I think that will tie up the circle, square the circle, finish the circle completely, whichever phrase you want.
Yes, Kevin?
Hi, Hannah. Just to say, I've just looked at the terms of reference, the draft there. You've got me down as being to be confirmed. You can confirm I will sit on your reference group.
Right. Anything else? Okay, so we've been asked to note the proposed timescales with the development and publication of the P&A in 2025, subject to any new guidance, that we approve the proposal to form an interagency Leicestershire and Rutland-wide P&A reference group to oversee production of the separate P&As for Leicestershire and Rutland, with the terms and references and indicative membership attached. And I think there's probably, from the discussions, there's probably some additions there. And then the board notes that under the current proposed timescale, a draft P&A will be presented to the Health and Wellbeing Board for approval to consult at its meeting on the 25th of May 2025. Are we all in favour? Thank you. Thank you, Hannah. Our next report is the local transport plan, pages 83 to 130. This report provides the board with an update on the progress of the new local transport plan and to seek feedback on the core prior to consideration by Cabinet. Ben Sims, the team manager for transport strategy and policy at the County Council, will present this report. Hopefully more on the health side, because I know how big this is. Thank you.
Good afternoon, everyone. Thank you for enabling me to come speak to the Health and Wellbeing Board on a local transport plan for Leicestershire. The aim of this report is to provide the board with an update on progress of the new local transport plan LTP4, which will cover the period of 2026 to 2040, but also seek your feedback and comments and any questions that you may have on the LTP4 core document before it's taken to Cabinet for consideration in November 2024. I do have a slideshow to run through for you. I will try and focus on the health and not everything that we're trying to do under LTP4. So firstly, what is the local transport plan? The local transport plan, or LTP as it is often referred to, is a requirement of the Local Transport Act 2008 and is the key mechanism for delivering integrated transport at the local level. It helps promote transport as an enabler of existing and future challenges and explains how transport impacts our local communities and puts in place plans for infrastructure initiatives and solutions to help people and goods move around the county. So why do we need a new local transport plan? Well, our current local transport plan, LTP3, is coming to an end in 2026. It no longer accords with national planning, transport and environmental policies, but also it has a real limited focus on the health and well-being of our communities and the potential benefits and wider benefits that active travel provides to Leicestershire and our local communities. An updated local transport plan through LTP4 will enable Leicestershire County Council to deliver transport solutions to the benefit of our local communities, our visitors and other transport users throughout the county, with the aim to meet the current and future needs of all transport users in a coordinated manner and enable travel choice, benefit all users, including car drivers, freight, public transport, walking, wheeling and cycling. We say that we include car drivers in there because car usage is for some of our communities, a viable means of access to key services, facilities and employment, being a rural county. Also provide wider public health, economic and environmental benefits for the local communities, and provide best value for money for our taxpayers. The new local transport plan has adopted a new structure from previous versions. The previous LTP3, I think, was about 800 pages and very technical. And whilst I might have enjoyed reading it, I'm not sure how many other people actually did. So what we've decided to do is try to break it down into manageable chunks, but also make it an easy read so our communities can read it, understand how it applies to them, but also hold us account on it. The first element of that is the core document, which we're currently out to we were out to consultation on. And underneath that, it will be supported by a variety of other documents. These include focus strategies, which I'll come on to in a moment, alongside the multimodal area investment plans, a county strategic transport investment plan, and then underneath that, monitoring our success, which will demonstrate how we've succeeded in meeting the core themes, vision, and objectives of LTP4. Just picking up on some of those. So in terms of focus strategies, these will identify and tackle specific transport challenges we have across the county, and these can be health focused. They will support strategic objectives from across the county as well, including the strategic priorities within the council's plan. They are high level, they are county-wide, and there will be synergy with other local, other LTP4 and planning documents, including the multimodal area investment plans, the county-wide strategic transport investment plan, but also the local plans developed by the district and borough councils. In terms of what are the multimodal area investment plans, or what we're calling MAPEs, these will set out a holistic investment plan for transport at the local level. They are one of the delivery mechanisms for LTP4 core documents and linked to the 5 core themes and 6 core policies I will show you in a few moments. There will also be synergy with the focus strategies, but deliver on meeting the locality's unique needs and requirements for transport, noting that our communities have different needs across the county. So by what we mean by that is Market Harbour may have very different needs to, say, Ashby de la Zouch or Melton Mowbray. It will also support the development of the local plan infrastructure delivery plan in terms of what infrastructure is required to support strategic growth through those documents, and they are proposed to cover a 5-year period but can be updated at any time. In terms of how we're developing LTP, we've sort of broken it into 3 phases. We have noted from the consultation responses we've received, the up to 2030, 2040, 2050 has caused some confusion because it sounds like we're going to do phase 1 and do nothing until 2040. That's not true. We're proactively in phase 1 at the moment and coming to conclude that through the core document. A key part of that work has been working with colleagues from across public health to identify data which can be important to feed into the LTP, but also asking them to provide a role as a critical friend to us in terms of the shaping of our vision, our policies and our core themes. We're now moving into phase 2 and we're at early stages of developing a series of focus strategies. At the moment, these initial ones include freight and logistics and safe, accessible and inclusive transport, but also we're starting to develop the first initial round of multimodal area investment plans as well. We're also working on phase 3, which is looking at how we monitor LTP4 and not only feed into what our KPIs are in transport, but how we can use the data to feed into health KPIs or performance indicators through public health. And we're working with colleagues on that as well. In terms of the challenges that we face by 2043, we have some significant challenges that we face. We're going by 2043, Leicester's population will grow by 23.3% above the East Midlands and national average, and the largest population group is expected to be those aged 65 and over. This means we need to tailor the transport network to meet those changing dynamics within our communities and the population, whilst not excluding other population groups, such as the young, who we're also identifying are more unlikely to drive due to the cost of owning and maintaining a vehicle. We're also going to expect to see an increased demand in vehicle kilometres travelled across the county by 29%, a 26% increase in demand for rail travel, and a 30% increase in freight demand across the county. And whilst we have infrastructure in place, it's whether is the infrastructure fit for purpose and is it the correct infrastructure that we need for the future. A key challenge for us around other modes is active travel. At the moment, we're only projected to see a 1.2% increase in travel by active modes across the county. And this is from an existing low usage at the moment, which is around 2%. We know the benefit that active travel and physical activity can have for the health and well-being for our communities, and transport's a key enabler of that. But also it can be a determining factor by not providing the infrastructure to enable people to have that choice. And that's a key challenge if we want to try and challenge some of those health challenges we have by 2043, which include a 52.1% increase in residents potentially living with dementia by 2040, a 9% increase of those suffering from common mental health disorders by 2040, and a 22.5% increase on existing levels by 2040 of those of the population aged 18 and over who is predicted to have diabetes. We also know that obesity is another key challenge that we need to tackle, and transport has a key role in trying to do that, to try and reduce the current number of adults, which is 64.5% of adults who are classed as overweight or obese, based on 2018 to 2019 data. We also have other challenges which we need to accommodate additional 120,000 homes across the county, and we need to adapt to climate change to make sure our network is resilient and reliable so people can get around to do their daily business, but also doesn't exclude people from opportunities to employment or social opportunities, or even just trying to get to the doctors or their hospital appointments. The final challenge I'll raise is one around a 5.5% increase in carbon emissions, which impacts obviously air quality, but also the health in terms of respiratory illnesses for our communities. And as an asthmatic, it's one that's close to my heart. But what I will say is that that challenge is also reliant upon the involvement and working with other providers, such as National Highways with the strategic road network through the centre of the county, which is one of the biggest generators of carbon emissions for the county. So using all this information and data, we've developed a vision for transport across Leicestershire, which is delivering a safe and connected transport network, which is resilient and well maintained to support the ambitions and health of our communities, deliver economic prosperity while safeguarding the environment. And this will be delivered through 5 core themes, which are enabling health and well-being, protecting the environment, delivering economic growth, enhancing our transport network's resilience, and embracing innovation. And these will be the golden threads that run through the focus strategies, the multimodal area investment plans, and the county-wide strategic investment plan. They are also the core themes which, where when we develop transport solutions, will need to be considered in terms of their development. Alongside this, we've developed 6 core policies. I won't go through them all in turn, but we have core policy 1, delivering the vision, core policy 2, managing demand, core policy 3, enabling travel choice, core policy 4, delivering solutions, core policy 5, embracing innovation, core policy 6, evaluating progress. We've developed these policies to make sure they encompass all 5 core themes. And we've worked closely with public health colleagues to ensure that health runs through all of these policies and has a key role within it. Alongside that, each of these policies in terms of their implementation has a clear health and well-being objective which is associated for its implementation. In terms of engagement and consultation, and we've been out to a formal public consultation between the 12th of August and 23rd of September, so we closed earlier this week. But we've also taken engagement from various groups internally and externally across the council, including meeting Cycle Youth, Vista, and the Cycling, Walking and Wheeling Forum last week. And actually this evening we are going to the SEND event as well. So from all of that and looking at the consultation responses, we are proposing to review the document and revise accordingly, with the proposal to take the document to Cabinet for adoption on the 22nd of November 2024. Obviously, I did say the consultation has closed, but there are still opportunities should anyone feel feel that they would like to provide comments to us, and they can utilise our tsap@less.gov.uk email address to provide any comments that they may have on LTP4. I'll conclude there for any questions and comments. Thank you, Chair.
Thank you, Ben. It's easy with words, isn't it? But it's a mammoth task to and balance on doing this work. And it's so refreshing. I mean, a couple of years back, I wouldn't have someone from transport sitting there and quoting all those figures about public health. So I think that's a fantastic achievement for both departments. So thank you, and right across the board. Has anybody got any? Yes, Christine.
Thank you. I noticed on the beginning of the slides we've got here, you've got electric chargers, right? One of my concerns is, and I've already been in touch with the highways, is the electric chargers aren't always fit for people with disabilities. The bays aren't big enough to open your doors. And then if you're in a wheelchair, you probably can't get down to the charger. But when you get down to the charger, there's usually bollards there to stop cars ramming them, but then you can't get to charge your car. And I know they said that it's in fit as what the national policy is, but I think as a county, we've got to start looking away from like what the national people say. You know, we've got disabled people that need extra, way of getting there. That's my first one. Bus sustainable. Right. We have issues, I think, with planning where there's a bus stop down the road. Yes, that's sustainable when the first application goes in. But then the bus company pulls that bus, and we've got no condition put on the planning to say if there's a sustainable bus route, that's got to be there for at least 5 or what years. Because it's happening in my area, and I'm sure it's happening in other areas, that the buses are cutting what they're doing. I'm not quite sure whether that's under our remit, but I'm having a go. And the other thing is, on new housing estates, there's a lot of places that haven't even got footpaths anymore. So you're not helping and supporting people who want to, say, walk somewhere. And I'm sure within these big new estates, we can have walkways. So if people want to do their Fitbit things or whatever and walk round, there's safe ways for them to walk on these new estates. I've had me say. Thank you.
Thank you. Ed?
Thank you. That nicely sets up a point and question I was going to raise, actually. Just in terms of engagement, you've obviously alluded to the requirement to link this work with local plans and the work that districts and boroughs are doing. Just interested, has this discussion been through the Strategic Planning Forum and the Members Advisory Group that oversees that work, just to make sure there's join up on this? So I can see you nodding, so thank you for confirming that, because I think hopefully some of the points you've made should be picked up by colleagues in that meeting. Just as a question, if I can as well, so the multi-modal area investment plans, the MAPEs, I think you described them as, you talked about obviously the different needs of different communities and places, quite rightly. What kind of area of geography are you using to develop those plans? Are they sitting over a district footprint or a different locality footprint? How are you kind of organising that structurally, just so I guess we can think about how to best link into those as district and borough councils?
Can I take Mike's question as well, and then you can answer them? I notice you're writing everything down.
So extending that a bit, because I actually think it does lead on from Ed's question. I was thinking about the role of NHS organisations as anchor institutions around employment skills and workforce. So either during the consultation, or is there an opportunity, if it hasn't happened so far, to include them in their thinking about what would work for them in terms of area investment planning?
Oh, sorry, yes.
Thank you. Just a quick one from me, Ben. Can I just check, given the volume of traffic on the roads due to University Hospital Leicester and travelling in between those sites and to those sites, have you had good representation from University Hospital Leicester colleagues in your focus groups? And if not, we probably need to set something up for us to be able to be involved. Thank you.
Thank you, Chair. I'll just try and come through some of those questions. So, noting the point about EV charging points and being accessible to everyone, we are planning to try and pick up that topic through the safe, inclusive and accessible transport focused strategy. we've noted a number of areas where the transport network has barriers which prevent all members of our community being able to travel or utilise the infrastructure that they need to. In terms of bus stops and bus services, it is a challenge, and we are sometimes beholden to the developers, but we are hoping through LTP4 to be able to strengthen our hand in a policy context to try and stop that, and to get bus services which reflect where our communities want to go to and what they need, and do what they need them to do. And the same with footpaths. Footpaths are important not only to serve that development, but as you say, for leisure purposes as well. And that's something else we're trying to tease out through LTP4. It isn't just about thinking about how people get to work. It's about how people use the transport network for leisure and for other interactions as well. In terms of engagement, we've proactively tried to engage with as many groups as we can, and we've advertised it a lot. I don't think we've necessarily had representatives from all of those groups. I do know the Leicestershire Partnership Trust has provided us with a really detailed response and want to engage with us further, and we will explore that with public health colleagues because I think that's an important relationship to have around that. And we have that relationship with the planning and district boroughs, and we were actually at MAG last week presenting there as well. I think I've covered all the questions. Oh, have I? Yeah.
It was just a question about the investment plans, what the kind of the area of geography they are built around, what structure.
Apologies, I knew I'd missed something. So we're actually looking at them not to be at district level. We're trying to look at them as basically a community need. So for example, I'm going to use Harbour again as an example, but you would have a mate for Market Harbour as an urban centre, potentially one for Lutterworth, but then you'd have one for rural Market Harbour, and how that links into those urban centres, because rural Market Harbour have very different needs than the urban areas and requirements.
Yeah, just makes perfect sense. Just to respond to that, I think one of the things that wasn't on your slide may well be in your purview already, but obviously this board oversees the work of the 7 community health and wellbeing plans, which are about delivering health and wellbeing outcomes at a local level. Just important to make sure that's linked in, because there might be some useful things to align for those very focused pieces of work with the activities and priorities of those plans as well. So again, I can see you nodding, so it looks like that's accommodated, so thank you.
Did you also pick up UHLs? Will you connect somehow to UHL because of the transport in and out for the hospitals? That's what you...
Yeah, I'll pick that up outside of this. That's great. Thank you.
Thank you. Gemma? Oh, Harshan, sorry.
Hi. So this might come out when you've got the results of the consultation, but we often have people coming to us saying that they've got an appointment at the hospital and it takes out the whole day because of the way the public transport is, because the appointment's in the afternoon, but they have to actually leave in the morning because otherwise they won't get there. So I'm just making sure that that kind of thing is taken into account, because that's one of the issues that people raise with us when they're talking about access to the hospital in particular.
So it's one of the challenges that we note that we have for the transport network. As I said, LTP4 will hope to set the policy framework to try and resolve those issues, but obviously then we've got to deliver it and work with various partners to actually deliver it. But we do know, and it has come out through the consultation response about reliable public transport and getting to health facilities and other opportunities.
Is that from everybody okay? Right, we are asked to note the work undertaken to develop on Leicestershire's new LTP4, and that the feedback provided by the board be presented to the County Council's Cabinet for consideration. So we're all okay with that? Thank you very much for the work you're doing, Ben, and for the team. And thank you for a more holistic view on travel. Thank you. We're now going to move on to the Joint Health and Wellbeing Strategy subgroup update from Children and Families Partnership, pages 139 to 146. This report provides the board with an update on the progress and delivery of the Joint Health and Wellbeing Strategic Priorities Best Start for Life. Marla Razak and Rachel Sharman will present the report. Hello.
Thank you. So there's a fair bit of information in the report, so I'm just going to pick out some key areas to provide a bit more detail for a bit of an overview. So work has continued to deliver key areas of action, and this includes continuing work around raising awareness around the first 1001 Critical Days agenda, where the focus has continued to be on workforce development and communication and campaign activity, raising parent and carer awareness of the key messages around the support, the importance of early development opportunities and support for children from conception to age 2. And activities included a baby fortnight, which was a workforce development campaign that included a range of workshops and sessions aimed at professionals across LLR who work with parents or carers of children who are in those early years. Sessions were delivered by partners including LPT, Children and Family Services, Home Start and Active Together. And some of the workshops included working with dads, being active in the early years and safe asleep. Work around school readiness has also continued. And again, the focus on this area has been around working with the early years provider sector to develop and promote the expansion of childcare for working parents in line with new funding entitlements that are, have already come into force or are coming into force. Work's also continued around family hubs, but I'm going to hand over to Rachel in a few minutes to provide us an update around that. And the last bit that I wanted to particularly pick up was around the holiday activities and food programme. Going to try and share something in just a second, but the Holiday Activity and Food Programme is a DFE funded national programme aimed at combating holiday hunger and social isolation for vulnerable children through offering free holiday clubs, including a healthy meal for school-aged children who receive free school meals. We're coming to the end of the current 3-year funding allocation from the DFE, which ends in March 25, and we're hoping to hear some really good news from the government when they announce their the decisions about the spending review, and we hope that this funding will continue in the future. Our Easter and summer delivery continued to be successful. In the summer, we had 34 providers, so that included schools, multi-sports providers, out-of-school providers and voluntary sector providers who delivered half clubs from 96 venues across the county, and we're still pulling the data together for our summer monitoring, but that's around 28,000 sessions were accessed by children over summer, so that's 28,000 meals that children got that they potentially otherwise wouldn't have had. I always think a picture speaks 1,000 words, so I'm going to have a go at sharing this. Share for me. There we go. Just making sure the sound's on because wonderful. So the first picture I wanted to show you is some pictures from one of our providers who deliver from Agar Nook in Colville. And one of the things that they did over the summer was that young people worked with a graffiti artist to design and then decorate Agar Nook Community Centre. And they really enjoyed taking part in that whole process. And that's obviously something that's there for people to see in the community to see. So that's like something that's lasting afterwards. And here's just an example from one of our schools trusts who deliver from a number of their school venues across the county. And it just shows some examples of different activities that children may not have been able to take part in without going into HAF. So being on the rebounders and taking part in sessions where they've had external sports providers come in and deliver for them gives children some new opportunities. And here's an example from one of our voluntary providers who deliver from Loughborough. That's the biggest fruit kebab I've ever seen before. And then children also get opportunities to go on trips that they may not otherwise be able to go on. And I'm hoping to be able to play a video for you that shows one of our early years childcare providers. So I think that just helps people to see just the great fun that children are having. That's just one example of the many, many clubs. There is a link to the 2023 HAF annual report in the papers, and that's got some more videos and links if you wanted to see things that happened last year. And it's also, there's also that link takes you to the HAF page where there's a lot more information about that programme there as well. So that's where I'm going to end my bit, and I'm going to hand over to Rachel to talk a little bit about family hubs and the work that's been going on there.
Perfect, thank you. So I'm just going to try and share my screen. I've got a few slides that I'd like to share with you. So just to introduce myself, my name is Rachel Sharman and I work for Family Help in the Children Family Services, and I've been working on our Family Hubs development for the last 18 years. No, I haven't, 18 months. It feels like 18 years sometimes. So I just wanted to touch on 3 particular focus pieces of work that we've been working on, because there's been some real developments in relationships that we've had. So the first piece of work is with GATE, which is the Gypsy and Traveller Equalities Unit. And we wanted to work with them from the Family Hubs perspective, just to get a feel for our own knowledge and understanding of their community and what that means for them and the barriers that they have to services. So the whole ethos behind Family Hubs is to improve access to services and to improve relationships that we have, not only with our communities that we work with, but across professional organisations that we work with. So we did commission GATE to deliver some information sessions for us, and they actually delivered the last one yesterday. And there's been a huge uptake of professionals from across the Early Help Board and partnerships to want to be part of that, to want to learn about how we best connect with marginalised communities. And certainly the online ones, we had 100%, so they were limited. We had 100 people at both of those. And then Jackie, who leads GATE, has delivered 2 face-to-face. So her last one yesterday, I think she had about 70 people at the last one yesterday. So across the summer, there's been 4 workshops, and there's been a great interest in the work that GATE do. So the slow dripping of information that we've kind of given to everybody around GATE, we're getting a lot of interest in people wanting to engage with their community more. I think one of the big benefits was that we were fortunate enough to be invited to visit them. So they're based over at Beaumont Leys in Leicester, but they actually cover Leicester and Leicestershire. And there was a focus group. So on the photo here, you can see some of the members of their focus group. They're a women's focus group. And we very much were talking about women's access to health services at this meeting. And their perception still is that there are barriers for them. They very much rely on trusted relationships with individuals before they'll ever access a service. And their perception is they still don't feel they've got that. So often there will be, particularly younger women, they choose not to access their key health appointments, and they only will attend them if they are encouraged by older women in their communities. So we had a big conversation about that, and from that I was able to have a conversation with partners that we've been working with in public health to get them to think about what can we do differently, or how do we advertise those appointments differently to the women in these particular communities. So that's an ongoing piece of work. And then very basic things for them, like they very much value libraries. Libraries is a safe space for them because they're not going with a fixed agenda. They're going to access the computers predominantly in libraries, but they often will, and I'm talking, this is about Leicestershire and Leicester City, so this isn't just a county thing. They'll often be refused something as simple as being able to use the public toilet in a library because of who they represent and the fears around the community and what might happen using a toilet. So we've started to open those conversations up with partners in relevant departments to make sure that that isn't something that somebody has to endure when they want to use a public service. So it's been very healthy. It's challenging. There are challenging conversations to still have, but certainly from a professional point of view and from a personal point of view, I feel that the relationships are there that I didn't perhaps have 2 years ago, so that they have got that person that we can liaise with, that I'm able to then pass information on or set up conversations with that particular focus group to help forge those relationships and move things forward for them. And I am to catch up with them in the middle of October to kind of feed back to them the conversations that have happened. But it's definitely something that's still a challenge for them in their community, that although the services are there, they don't feel confident sometimes, and it's not all of the members of their community to access them. So it's very much around the relationship and forging that and being tenacious with that and a bit persistent to make sure that those families are accessing support. So that's an ongoing piece of work. And next piece of work I would like to share, but it won't move on. Bear with me. Is maternity equity. So we all know that, you know, those first 1,001 critical days are absolutely crucial for the best start in life for children, and accessing maternity services, that is that first part for those babies and their mummies. So as part of Family Hubs, we engaged with Heads Up, so you may know of them as the Centre for Fun and Families, and they did some research for us, because what so our red flag for us across Leicestershire was a particular cohort of families in Loughborough. So in the Leamington and Hastings ward, we had got some families that aren't accessing midwife appointments at the earliest point possible to them. So they're accessing them, but they're often known as late bookings. So then that means that their whole journey of their relationship with midwifery services and beyond means that their bookings are, their appointments are later than they might be for other women. So Heads Up did some consultation across the area. They spoke to local families, they spoke to local professionals in the area. And from that, we decided that what might be right and an easy piece of work for us to incorporate into our existing support is that we create a voluntary role. So a maternity champion is a voluntary role that we have created. We have worked with our colleagues in midwifery, we've worked with local women, we've worked with colleagues from public health, we've worked with colleagues locally and volunteers locally. And we have a maternity champion role that the training is currently being rolled out as we speak. And these people will be those trusted people in the community that are able to talk to people that they know are in their early stages of pregnancy. So this is both parents, to raise the importance of engaging with midwifery services as early as possible. We have a session that's being delivered tomorrow afternoon. That will be our second training session. And then aside from that, we've created a physical resource. So we have it's one resource, and one side is for dads, the other side is for mums. And that has been created in 7 different languages. And we will have that across the area across Loughborough that we are going to concentrate on, and those will be resources that are available in any community venue, so people don't need to know the detail of what's on those, but just so that it's something that somebody can take for free if they're in the early stages of pregnancy and they're not quite sure where to go next. There's information on there. There's QR codes to Start for Life on the NHS website. There's information that takes them to the Family Hub's web pages that's got further additional information on there. And the idea being that we will continue to roll this out. So we won't hold training sessions where everybody's got to come together. We will be working across the patch, and when we get identified individuals that we think will be the right people to become a maternity champion, we will sit with them, we will talk through the leaflets, we'll talk through the key messages that we've agreed on, and they will then become a maternity champion. So it's a low level support, but it's absolutely essential. It's the right people in the community rather than it being external professionals that families don't particularly want to engage in. So again, that's it. We've started the training, and we will be watching carefully to see how we can develop that in the future. And then the idea being that the model for that is something that we could lift and use elsewhere with a different community if we feel that community needs aren't being met. We do have volunteer development officers in our service in Family Help, so they will be the people that will be the support network for the volunteers in the local community. So as a model, we're very interested to see how this works, but certainly for this community and from what the data tells us, it's something that we're quite excited to have in Loughborough, and we look forward to being able to update you on how that's working and how that feels for people locally. And then finally, I just want to talk to you about reducing parental conflict. So reducing parental conflict has been on our agenda for some years now. And this is very much around encouraging families to think about the way that as parents, they communicate together. So parental conflict is it's on a continuum, it's on a spectrum, I guess, if we need to link it to anything for domestic abuse. But it's where we've got these families where it's not that imbalance of power, but there's this persistent arguing that is unresolved because as a couple, they don't know how to stop arguing, and they don't know how to behave differently without some intervention, without some support. So parental conflict is being rolled out across Leicestershire. And to date, this is actually an older slide, but we have trained over 600 professionals now, and we are very excited that 80 plus schools are involved in that. And actually, we are doing a bespoke training with St Bartholf's over in Shepshire. They're having whole school training on reducing parental conflict that we, I suppose, as professionals call RPC. We don't use those phrases with families. With families, we wouldn't obviously ever use conflict in a conversation. It's relationships matter for us when we're talking to families. But St Bartholf's would like it as a bespoke piece of training. They're very keen that every single member of staff in their school has an awareness of this, so that regardless of which touch points there are for them with their children, the families that they support, people have an awareness of how to have conversations with families. The visuals that you can see on the slide, this is an organisation called 1+1, and we have a licence for these flyers until January 2025, and that is a QR code that parents can access. So they access online training, they are no longer than half an hour, and they are able to access support if they don't particularly wish to engage with professionals, but they feel they would need some support about getting some help to communicate differently with each other. And the reducing parental conflict, as you can see on the slide, we have a core development group. So as a whole group of people, we come together to look at how we want to design the materials. We have a whole host of materials that we use across our partnerships, and they have been designed with representatives of everybody from that core development group. So we have training every term. So as it says, we've got more training coming up across the autumn term, but this very much is about family health and well-being. And we do have some beautiful stories where families can tell us that they're really clear that what they don't have is domestic abuse, but what they do have is just an ingrained way that they behave with each other, and when they are supported with it, their well-being and the well-being of those children that live in those families where there's chaotic communication has improved. So I thought it was important that we shared those pieces of work with you today. Thank you.
Thank you. It's really nice to hear from the subgroups and to flag up the work you're doing. And there's a lot of health impacts within the work you're doing. So anybody wish? Yes, Rachel.
Thank you again. A great presentation and loads of work happening there with I think a lot of cross fertilisation for a lot of the other work that's happening. So for me, I'd be really keen and interested to think about how we create a relationship between the Women's Hub pilot that's happening in the county at the moment in North West Leicestershire. But more than that, the integrated neighbourhood teams and the Family Hub leads in terms of making sure that we link this work in, and more importantly, I think develop those relationships and make sure that we have a really broad spectrum of knowledge and awareness about this fantastic work that's happening. Because I think it'll be so useful to other people within the integrated neighbourhood teams in terms of feeding that into their own service areas, but also in terms of being able to share and spread the word of the great work that you're doing. So I'd really like to connect with you after the meeting, Rachel, just to think about how we do that.
Just to let you know, we are involved. We have been part of the earlier conversations with the Women's Health Hub and the pilots happening in North West. So I can catch up with you about that. But there has been a lot of cross-sector work and conversations, and absolutely there's relevance, particularly with our partners in public health.
Rachel.
Thank you, and some amazing work outlined there with a real clear community focus. Really nice to see. Thank you. I guess I've got a niggling doubt about my perinatal mental health access standards. So we, as a system, have never achieved the target, but more importantly, that means that women aren't getting the support that they need. So I'm just interested in the maternal health side of things that you talked about, and whether when you talk to Rachel, you could pick up the perinatal mental health link as well. There's so much support out there for women. We can't get people to access it. So what we'd like to understand is the offer wrong? Or is it just that people don't know about it, and some investigative work in that sense? So your group that you reference will be really useful for if we could just link some of those questions up, please.
Yeah. Thank you. Christine.
Yeah, that was very, very interesting. I'm fortunate I sit on quite a few of these committees, so I know what's going on. But obviously a lot of people don't know what we're doing and what good work we're doing. And it's such a shame that I don't quite know how we can get it out and about, that this is available, that if you go along to these hubs and that within most of them are in the libraries, that this is available and you can get more information. And it's a shame that you're doing a lot of work and a lot of work goes on within the county. But I would imagine only 2% of the people that live in the county know exactly what we do and what's out there. And it's such a shame when that's such a brilliant scheme and a brilliant idea on what's available.
I mean,
I'm not quite sure. I'm not having to criticise it.
No,
it's just a shame that all the work that you do or we do isn't known to even the councillors within the council, let alone the public.
I mean, some of my response would be, and I do agree to an extent, I think it's important to know that some of the activity that we both share today is for a very targeted group of children and families. So we wouldn't necessarily want to extend that universally. So that feels right. But definitely with the work that we've been doing around family hubs, it's been re-establishing some of those relationships that perhaps have been lost, whether that's people have changed jobs. COVID never helped any of us, but we're miles away from that now. And for me, very much so, I think some of the value for us in the Family Hub work that we did was around having 2 members of staff that were those community engagement workers to make those connections with the right professionals. And that's a never-ending piece of work, is it? So that we're able to connect people together professionally so that people are aware of what's going on. And I take that on board, absolutely. I think there's always an opportunity for a conversation with people to kind of to spread and raise awareness of what we're each doing so that we don't have that duplication, but where there is crossover, it's appropriate. So I do get that. I think we're a huge machine in a local authority, we're a huge machine in public health, aren't we? And getting all of that to sit tidily next to each other so we're all aware of what's going on, I guess was one of the ambitions of the Family Hub's website. So the Family Hub's website is that online space, and there is a space there for professionals so that we can be sharing resources, be sharing the work that we're doing and raising the profile of the stuff that we do for families who are accessing the website.
I take on board what you said, but a part of the family, say a grandparent or a parent, might know that a young family are going through some of the issues.
Yeah.
But the young family don't realise they're going through these issues because they, like you said, they're arguing all the while, but it's not got any vicious. But perhaps the parents would know what's available to help support the young family. So I'm not quite sure how, I'm just rambling on, but I don't quite know how we can be out there to support some of the, the families that, the older ones of the families. And like you said, you're going to the older people in certain ethnics to go out and support the youngsters.
Jane?
Yeah, I think one of the things we probably didn't describe is how kind of well embedded the family hubs are, both in a kind of locality as well as through our referral route already. So I know the work that Rachel described about working with schools to understand just the concept of parental conflict helps that kind of flow through. So the family hubs programme is part of our referral route through children's services. So where people in schools or in communities do have worries about their children, that they'll be funneled through almost to the family hub. So that's already happening. I think in terms of the comms around family hubs, it's been one of the biggest comms programs we've had in the department for a long time. So we're sending out regular stuff to all sorts of partners, but I know there's always more we can do to make sure that it's at the tip. I think the other bit that the family hubs have done well, and I think the question around more strategic link up is good, is that at a locality level, the family hubs are really well embedded in and working with the neighbourhood teams and with all sorts of partners at a local level, which has meant that we're able to bring services together. And I think those comments around the kind of strategic tie that are really, really helpful. But so the family hubs is part of the referral route for children's services. So they are services that anybody can, well, not anybody, but a targeted service for people where there are worries, and part of the work with schools and other community groups mean that we then will pick up on those issues that you're raising as well.
I think going back on one of your other points, Christine, one of the reasons we were wanted the subgroups to come and give us updates is to actually publicise the good work that is going on that has always been done behind the scenes. And I think it's really important to flag up what is being done. Anyone else have anything to say? No? So we're asked to just note the progress being made to deliver against the Best Start for Life strategic priorities of the JSNA. So all happy to do that. Thank you very much for coming along and sharing that. And I think there was more than the children enjoying the HAF. I noticed, Mrs. Taylor. Right, we're moving on now to the Leicester and Rutland Safeguarding Adults Board Annual Report and Business Plan, pages 147 to 192. This sets out the annual report and business plan and is shared with the board to highlight safeguarding matters relevant to the work of the Health and Wellbeing Board. John Wilson, Director of Adults and Communities, will present the report. And thank you very much, John. I know you're extremely busy at the minute, so thanks for making it.
Thank you very much, and my apologies for late arrival. I also just need to apologise on behalf of Shona Douglas, who's the independent chair of the Adult Safeguarding Board, who would have normally wanted to present the report this afternoon, but is unfortunately unavailable. So I'm presenting on her behalf. It is a statutory requirement that the Safeguarding Board produce an annual report and present it to the Health and Wellbeing Board, amongst others. This report is an annual report based on a business plan which covers 2 years. So this is the second year of the business plan. And the report details the priorities within the business plan over the 2-year period. Just going into some of the detail of the report, there are a number of priorities that we are taking forward over the 2-year period. The first of those is around self-neglect. And within the last 12 months, based on an audit of self-neglect, but also some other work around cuckooing that we've undertaken, we have actually revised and reviewed all the guidance around self-neglect as a board, and we are just in the process of introducing new self-neglect guidance for the partnership across Leicester, Leicestershire and Rutland, which will replace the existing VARM guidance and VARM process. The VARM, the Vulnerable Adult Risk Management Process, was put in place a few years ago, and has been used extensively, but not always necessarily in the right way. And it became a bit of a catch-all and lost a bit of focus. So we have replaced that guidance with some new guidance, which will be taken forward over the course of the next 12 months, which is will detail much more clearly for colleagues across the system how to take forward self-neglect concerns, and whether they become safeguarding concerns or other concerns. There are processes in place that will help with that. We have, in addition, undertaken some work on the Mental Capacity Act. This is a bit of a Forth Road Bridge issue, so if you've heard any of the previous annual reports over the last few years, you'll have seen that the Mental Capacity Act probably featured in all of those too. So it's really around ensuring a good understanding and awareness and knowledge and use of the Act, and using the Act in the most appropriate way at the most appropriate times. It's a very complicated piece of legislation, and it's understandable that this is an issue that we have to return to on a number of occasions, because it is one of those areas that is not always understood fully, and unless you are a specialist practitioner in the area, it can be quite a difficult concept and to understand and use appropriately. But we have provided additional training both internally within organisations, and we've also commissioned external training for the partnership around use of the Act. And it continues to be an area that is flagged when we do safeguarding adult reviews. When we of course to do those significant reviews, it's one that's flagged probably more than most as a factor, a learning area that we need to take forward. Third area that the report details is around domestic abuse, and particularly domestic abuse in older adults, which is one of those areas that's sort of hidden, one of the hidden harm areas that's largely not talked about very much, but is becoming, I think, probably has a higher degree of awareness than perhaps it was a couple of years ago. We've been involved with the University of Durham doing a piece of empirical research around perpetrators of domestic abuse in older adults, and that report is being published, and our involvement in it has been key, and we are taking forward the recommendations from it. And we've also jointly with the Norfolk Safeguarding Adults Board produced a short video around domestic abuse in older people, which is on the Safeguarding Board website, and there's a link within the report to that. I think the other thing that is probably worth noting within the report is that we have changed our process for recording safeguarding alerts over the course of the last 12 months. So if you read the report, you'll notice that we've had a 70% reduction in the number of alerts that we have recorded, but we also have a 60% increase in the number of inquiries that we have started, so the number of investigations that we're taking forward. Essentially, we were collecting, I think it says over 5,000 alerts that we recorded in the 12-month period prior to this. That was a very high number, and it made us a bit of an outlier compared to comparator authorities. And what we've done is we've strengthened our reporting process, and we've been much clearer with people about what constitutes a safeguarding concern, as opposed to perhaps a concern for welfare. That doesn't mean that those concerns that are reported to us, if they don't meet the threshold for a safeguarding concern, we still take those forward in other ways. So we'll still take them forward as a Care Act issue, if it's an eligible Care Act issue, or we'll take them forward as a cause for concern in other ways. So they don't get lost, but we don't treat them as safeguarding. referrals any longer, safeguarding alerts any longer. And what that's meant is that we've been able to dedicate more resource to actually undertaking the investigations and the inquiries. So our what we call the conversion rate, which is, the number of inquiries that stem from alerts has gone from 10% to 46% over the course of the last 12 months. 10% made us quite an outlier nationally, and with comparators, it's quite a low conversion rate. 46% is probably towards the top. In fact, it is within the top 10%, I think, nationally. So we think that that was the right thing to do. We're confident that we are now undertaking the inquiries that we need to undertake, and we're making sure that we complete those inquiries in a timely manner. So we monitor on a quarterly basis how many inquiries have been completed within the quarter to make sure that we haven't got safeguard inquiries that are outstanding for longer than they need to be. But happy to take any other comments or questions, Chair.
Could I just ask one for clarification, John? I may be reading it wrongly, but you've got on your inquiries, the neglect and acts of omission is a lot higher than the self-neglect. And you say that, and it also says that the most common category remains neglect and acts of omission. I just wondered, is it because of the work you've done about cookering and everything that you have chosen self-neglect, or is there another reason for it?
I think self-neglect is an area that is perhaps more difficult to identify often. And again, it comes back to that issue of capacity often. So if does the person have the capacity to determine whether or not they are able to care for themselves? Is it an unwise choice, or is it an act of neglect? I think self-neglect is a particular area of concern, and possibly an underreported area, as opposed to neglect or acts of omission, which are probably easier to identify.
Any other questions? No. So we're asked that the annual report, the business plan and the key points of relevance to the board are noted. Yes. Thanks, John. We'll move on to item 10, which is Leicestershire and Rutland Safeguarding Children's Board Annual Report and Business Plan, pages 193 to 248. This report sets out the report and business plan to share with the board highlight relevant safeguarding matters. Jane Moore will present the report. Thank you, Jane.
Thank you. So, yeah, this report is presenting to you the Leicestershire and Rutland Safeguarding Children's Partnership annual report for the business plan. It's a statutory duty that every year we produce an annual report, and I've set out the policy framework that governs that as well. The purpose of the report is essentially to assess the impact of the work that was undertaken over the last year by the safeguarding partners and partnership, and specifically looks at the performance against those priorities that were set out in the business plan. So within the report, we've outlined all of the learning assurance, training and improvement activity that have had an impact on safeguarding children across Leicestershire, and there's a full version appended to this report as well. So just a few of the key messages specifically in relation to the report. We've done a lot of work around safeguarding babies' business priority, and particularly in response to national concerns around injuries to babies as well. And you can see that we've made some improvements to local procedures. We've improved our quality assurance processes and learning activities, but also developed a number of learning resources for practitioners as well around injuries to babies. And we've outlined there the promotion of the ICON work, which is an evidence-based programme around reducing head trauma and kind of dealing with babies and safe sleep. And alongside that as well, developing our safer sleeping risk assessment tool. We've continued to work and deliver around child mental health and emotional wellbeing, and some of that is including getting some of the assurances from CAMS around the progress of the services, and also pathway around referrals for children with emotional wellbeing. We've continued to focus on keeping adolescents safe, so working with those young people particularly, and that works strategically linked with the Strategic Partnership Board through the Criminal Exploitation and Serious Violence Delivery Group, and focusing on those young people who are being criminally exploited or are at harm from outside of the home in their adolescence. We've continued to focus on the priority around safeguarding children from diverse backgrounds as well. And we have continued to work on the effective safeguarding of children in independent and out of school settings as well. And we've done that through the engagement of the independent sector. We've focused specifically this year on some work around autism and safeguarding, and linked that with the prevent agenda as well. And then finally, we've focused on some work around transitional safeguarding, and we've set up a task and finish group to look at work that we need to continue to do there, and that bit of work is ongoing. So in terms of the business plan for 23-24, we've set out a number of deliverables and activities that we need to undertake in order to hit the priorities. And again, we've appended the business plan to this report. And at the top of page 196, you can see that we're continuing to work on those priorities going forward. We've consulted on the annual report in a number of forums now prior to it being published, and I'll leave it there. Actually, I won't go through the resources as well, but I'll leave it there. Thank you.
Thank you. Any comments or anything? No? Thank you. So we're asked to note the report. So thank you, Jane. We now move on to Health Watch Annual Report, pages 249 to 276. The purpose of this report is to present an update and summary of the activities undertaken over the year, and this report will be presented by Gemma Barrow with Hardip Chan to support. Thank you.
Wait for the, sorry, wait, see if the slides pop up. Thinking about it. Slides. Yeah. Yes, you, sorry, hold on. Stop.
Hello, good afternoon, everyone. I'm Hardip Chauhan, Head of Operations and Services at Voluntary Action Leicestershire. So while Gemma's just sorting out slides, I might as well make a start. So I asked to join this meeting because we are the contract holder for the jointly commissioned Health Watch Leicester and Leicestershire service. I've joined so that if you have any questions that you'd like to ask me, I can hopefully answer those for you. And just to give a bit of background, so I know Gemma's going to be presenting the annual review, but I thought I'll take this opportunity just to talk about some of the work that we've been doing over the last few months. With Mrs. Richardson and County Council officers and commissioners. So, Gemma, do you want me to carry on? Yeah. So just to say, some of the work that we've been involved in has been around strengthening the way that we demonstrate our impact and the patient experience and voice that we have coming through the Health Watch, the work that we do with Health Watch. But for the Health and Wellbeing Board, I'm really interested in the way that we can work to support you and the priorities that you have. So we, the first year for Health Watch, when they moved over to Val, so last year, was like a transition year. So we did a lot of work around what do we already know, what patients are sharing with us, what experiences they're sharing with us, what we have learned, what's working for us. And because that year is now complete, this year is very much about targeted work within communities, aligning some of our priorities with your joint health and wellbeing strategy, just checking I've got that right, and making sure that we've built in capacity with the priorities that we have to be able to report back to yourselves as a board on some of the priorities that are coming to yourselves, and the way that we can support that process. So just a little bit of background on that. What we really want to do is make sure that we present a patient experience in line with some of the data that's already available through our public health colleagues, and stakeholders and meetings that we already attend. So once Gemma sort of delivers her presentation, I'll be quite keen to hear your thoughts on that and how we can support this board going forwards. And if you have any questions about how we've aligned the priorities and a bit more detail about the priorities that we're looking at for this financial year, I'd be happy to answer those questions as well. So thank you for having me.
Thank you, Hardy. Thank you, Chair. We have our slides. I'll talk to them anyway. So obviously in the paper we've put in obviously our annual report, and just we wanted to highlight some of the key things that we did last year. So during 2023 to 2024, we engaged with and supported over 8,000 people to gather their feedback to improve services. Some of the highlights that we did was we published 12 reports across the year, highlighted people's suggestions for improvements with their local services. We attended 248 community events to hear people tell us some of the struggles they may be having with accessing their GP practices, issues around NHS dentistry, mental health concerns, and hospital waiting times. We actively listened to asylum seekers residing in hotels across the region. We partnered with some of our local NHS complaints bodies to engage with over 20 Bangladeshi women to empower them in resolving NHS complaints and understanding the system and how that it works. We relaunched the Are You OK campaign on World Mental Health Day, and we ended up engaging with over 1,000 commuters. We organised some 10 chai, coffee and chat events to gather feedback from diverse groups across the city and the county. And we conducted 17 interview visits to local services and did some work with our national body, Health Watch England, to provide insights into improving community diagnostic centres. So I wanted to just give an example of some of the work, one of the pieces of work we did last year. So on World Mental Health Day, we were different teams were in Loughborough, at Market Harbour and Leicester stations throughout the day, working with our colleagues at Leicestershire Partnership Trust, at Voluntary Action Leicestershire. We took a collaborative approach because we wanted to make sure we were working in partnership with service providers and the colleagues who wanted to reach people. And we thought this would be a good idea to relaunch the campaign. So we wanted obviously to engage with the public directly, provide important information about accessing mental health services with a focus on promoting early help, urgent support options, ensuring that people are receiving the right care at the right place and time. So across the day, our teams, different teams, we had one person who went through the whole day, which was really fun for them. So 7 in the morning, we're at Loughborough to reach some of the students, all the way up to 7 in the evening. So we had one person travelling, using the rail network across the day, moving equipment and helping, reach people. And we had some really good conversations with people about their mental health. We gathered lots of feedback on local services. And I say we were able to raise that awareness of mental health within the community, really listening to people's issues and concerns. We documented the day across our social media. And I say we distributed over 1,000 leaflets directly to commuters. And we know this because we had boxes and we were able to count what was already gone, what we didn't have to take back. And we found that this direct approach to the promotion helped to increase in that community awareness. And say we had a real successful day. It was a real good collaborative approach with everyone who was involved in that piece of work. So again, some of the work that we do directly influences decisions made at the Leicestershire and Rutland Integrated Care System. Some of the key outcomes across last year was some of the work we did around NHS dentistry, raising concerns about access and affordability, pushing for improvements aligned with the National Recovery Plan, again, based on what people have been telling us. Our Living with Dementia report fed into the Leicestershire and Rutland Dementia Programme Board strategy to improve diagnostic pathways. And the other example I wanted to give was around the visits that we have been undertaking to some of our services down at University Hospital of Leicester, so down at the Adults Emergency Department. And we've been in September 2002, and we went back exactly a year later because what we wanted to establish was where the patient feedback, things we noticed the first time we made recommendations, had things improved. a year on. We've been working closely with the team at UHL, and we've seen improvements in the signage, wheelchair access, the patient calling systems. The team at UHL have made a real proactive approach, and we know they've had significant efforts to improve the patient flows and address those identified issues. We found that actively engaging with the patients helped to implement, with working with UHL, some of those recommendations. And we've noticed, obviously we go out a lot, we talk to a lot of people about some of that overall patient feedback within the emergency department and the different ways people are feeling about it, and more of a positive view that people are taking when we ask them about how they access that service. And then UHL put together an action plan, which is within the report. So with an update on our recommendations from the first report and how things have moved on when we did our revisit. So a really positive piece of work. And then, as Hardip mentioned, we've been looking at our priorities for this year, building on what we heard from last year. So we identified with our board 3 key areas and priorities for the year based on the feedback that we get from our local communities. One around GP access, dentistry, and young people's mental health. And within all of these, we've just put some top level what we're going to do in those, but within all of these, there are different projects that we are doing within those broad areas. And we'll also be continuing to conduct our interim review visits. We've done a lot this year already. We've done children's emergency department. We're going to do eye care services. We are continuing with our supported living project that we've been working on. And we're going to be doing some a big piece of work with the deaf community looking at access to services. So in closing, that is my last slide. You know, we're really passionate about going out there, talking to our local communities. And our goal is, as always, to amplify the voice of the community to help improve health and social care services for everyone. I should stop there.
Just before we move on to comments and questions, following on from that, just to give some idea of how these priorities came about, as Gemma alluded to, we took a lot of the data that we'd already got. We spoke to a lot of the system leaders across the system to see what they were working on, and we did align our priority areas with the health and wellbeing strategy that this board had already approved, the ICB strategy and UHL strategy, to make sure that what we were working on aligned with what they were doing as well. We've also continued to strengthen our team and our board, so we have expanded our board, and there are more members on there. We'll continue to strengthen that so that we are in the right places at the right time to be able to influence and share those experiences, so that we can make sure that the experience of the patient at the end of the day is improved for everyone.
Getting the information in early enough to make that that impact. So thank you for that. Has anybody got anything they wish to comment on? Say no. Oh, Mike.
Again, it's not so much a question for Healthwatch, but I suppose it's, or I suppose it is really. There's always that kind of feedback loop in terms of the report that tells us what you've done, how many people have been involved, the number of reports have been redone. I suppose it's looking for case studies of where that's has fed into reviews, and then actually what the response has been from organisations. So aware that kind of we and colleagues around the table need to do that feedback loop for you. But have you got sort of those case studies of recommendations leading to action and then feeding back into you?
Yes, so we did some work around asylum seekers last year. That, although it didn't go to the ICB board, it did go to a subgroup, the Equity Committee, and there was a presentation there about some of the work that followed, some of the recommendations that we'd made. So they've done a project on it and working to improve the access and some of the things that we raised in that report. And I think actually, Mike, you were at that meeting, so you heard about some of the good stuff that had happened as a result of that. I have spoken to the ICB, and what we're trying to going to be doing as we move forward is make sure that when there are pieces of work like that, they maybe hit the agenda here, but also at the ICB and maybe UHL. So we're looking to make sure that, as you said, we close that loop so everyone is aware of some of the stuff that we've done.
I'll do.
Just to follow on from that, Healthwatch are not required to follow up and report back on the recommendations. However, locally, we have implemented a process, particularly this year, looked at that to strengthen that, and that actually we do close that loop, and we will go back and we will report back on. And we've also been looking at the way that we sort of demonstrate our impact on our reporting, and if that's fit for purpose for different boards actually, and we're looking at the ways that we might present that. So open to some ideas and what you might need, and we'll change that for, you know, it will be different for this board in comparison to another board or even the City Health and Wellbeing board meeting. So we're more than happy to make changes as needed.
Simon?
Thank you, Healthwatch colleagues, for this really positive report. I just wanted to reflect on the positive feedback regarding UHL's role in making improvements following previous Healthwatch visits. I think we're committed at UHL as a board to not only working with our Healthwatch and Voluntary Action Leicestershire colleagues through the Health Equity Partnership that we've just launched and other forums, but to actually take actions that tangibly improve the service we provide to our patients on the back of your listening and feedback. So it's really pleasing to see that we have achieved that on this occasion, and I'll take that back to frontline colleagues. So thank you very much.
Yeah, and I think, as Mike said, it's important we join that loop, because obviously refugees, we do a lot in council as well. So, you know, around this board, there's a lot of different partners that could do with perhaps having that input. Thank you. So we're just asked to note that report today. Is all well okay? Thank you very much for your work. Last item. We're going to the Health and Wellbeing Board annual report now. The purpose of this report is to present the draft annual report to the board for approval. This report will be presented by Mike Sands, and Director of Public Health, and Victoria Charlton, the Health and Wellbeing Board Manager. So thank you. Who's starting?
I think, more strictly speaking, will be presented by Victoria Charlton, Health and Wellbeing Board.
What did I just say?
Me.
Oh, sorry.
Victoria's doing it.
Well, that's what I've got on here.
Thank you, Chair. Am I on? Yeah, so this, the purpose of coming today is really just to present the draft content of the annual report for 23 and 24. It's to seek approval from yourselves, and also to acknowledge the commitment from all of the partners who've actually contributed to putting the annual report together, and also to approve the comms plan approach to actually promote the annual report going forward. I'm not going to go through the report in detail, but just wanted to pick up some key highlights really. Just wanted to point out that it's not a statutory requirement of the board to produce an annual report, but I think, as we've discussed previously, we've agreed that it's a really good way of promoting the work of the board and updating not only our partners and stakeholders, but also members of the public to the work of the board as well. As you'll probably have found, the report is the attached appendix, but it is quite a lengthy report. It was initially only going to be, I think, probably about 10 pages, but from the overwhelming contributions showcasing the work that is happening right across Leicestershire, it seemed right to include all of that stuff. It is still only a snapshot of the breadth of the work that's actually happening across Leicestershire as a whole, but it was important to sort of include that sort of breadth of work. So in terms of the report, so the report really sort of takes on the structure. You've got the executive summary, and then there's a foreword from the chair and the vice chair. We've also included a description of the role and the membership of the Health and Wellbeing Board. I think it's quite important to just sort of show members and the public what the purpose of the board is. It's not always quite clear. So it was important to include that, and also to give a breakdown of the description of the statutory responsibilities of the board. We've also included progress against delivery against each of those statutory responsibilities, which includes obviously the Joint Health and Wellbeing Strategy, the JSNAs, and the work of the Better Care Fund as well. That's also included, and we've got a number of case studies to really bring that project, to bring those pieces of work to life. We've got a looking forward over the next 12 months and what the areas of
priorities will be for the board, and that will be really sort of focusing on strengthening those relationships between system and place and neighbourhood. And really, I mean, a lot of the work that's happening with our colleagues across ICB is really sort of LLR focused, whereas this report centres around Leicestershire. And really sort of highlights the importance of place. We want to really develop the community engagement capability of the board, and already links have been made with our children and family youth groups and other sort of colleagues externally, so our LPT colleagues as well. There's a number of advisory boards to sort of bring that community voice to the board. And also we'll be looking at refreshing the joint health and wellbeing strategy. It's due a refresh after 3 years, and that will commence next year. So in terms of engagement and next steps, it was agreed in May, at the board back in May, that we would take the draft report to the Health Overview and Scrutiny Committee for feedback, and that was presented on the 11th of September. That was really, really well received by all of the committee members, and they particularly highlighted the links between the subgroups of the board and obviously the family hubs as well, and the work going on with there. So really today it's just subject to your approval. The report will then be taken to our comms and design team to format, and then we will then look at promoting it through a number of social media channels, both internally and externally. We've got an article that will go out in the Leicestershire Matters, and that's due in November, and then there'll be a short video as well, just to sort of summarise the key points in the annual report, and that will help make it a bit more accessible and palatable for those who don't want to read the 40-page document. And that's it. If there's any questions. Thank you. Thank you, Victoria, for all the work you've done on that. I think it's been really good this year to see how much has come in from all the various departments and partners, etc., around the table, and it really does give a good, well, it is a snapshot really, even though it's that lengthy, of all the work that is being done. So thank you. Anybody have anything? Yes, Kevin.
Just wanted to say, yes, I think it's a really great sort of overview of everything that's been going on. But for me, it's the case studies. Thank you, because I'm not trying to pitch you against the City Health and Wellbeing Board, but I was there this morning and I had to keep saying, where's the case studies? Where's the actual, what's going on? How can we tell that story about how people are finding things or the impact it's having for them? So seeing these case studies in there, I think are great, because I just get concerned. It's all good and well us sitting around here having the chats about, is this on track? Are we having an impact? Are we meeting a KPI? But we then need to be telling the general public about what we're trying to do and what we're trying to achieve. And those case studies make it real. So thank you. Really good read.
Mike?
Yep, I'd echo that again. Thanks, Victoria. That's good to see. Can never get it right, because it's like one would prefer a shorter report, but I think in this one it's worthwhile. Actually, it's one of those ones. Do you just focus on a few bits, or do you try and describe everything? I think with this one, it's worthwhile trying to describe a lot, because there is something for me about how we pitch ourselves quite rightly as the kind of the place-based board for health and wellbeing, at a time when the ICB and a number of other things are sort of happening across LLR. So, and that comes onto the engagement piece. So if the engagement was just kind of going, here's a report, I think that's probably the wrong idea. But anything we do around videos and Leicestershire Matters, I think the key thing is almost, it's Leicestershire, it's about the place, and then the case studies flow from that. If that makes sense, you know what I mean? The content of the report is almost secondary to the main message about us being here and about being the kind of primary place-based group in Leicestershire for health and wellbeing matters. It's been around for a while, but I think it's a good chance and a good time to reinforce it.
John?
Yeah, thanks. Excellent report. Really good. Thank you. A question and an ask. So the question is, and it's probably not for you, Victoria, but you might want to answer it if you can. So there was quite a lot on the news yesterday around healthy weights and obesity and sort of the fact that we've kind of stabilised nationally, it would appear. And obviously within the report, it talks a lot about the work that we're doing, but do we know, the question is, do we know whether we are in line with that kind of national improvement in Leicestershire or not, or do we not have the data yet? And then the ask is, I need to submit a whole load of documents, evidence of great practice in Leicestershire by tomorrow lunchtime, and a copy of this would be really helpful. So if you could send me a copy, that'd be great. Thank you.
Someone say CQC. On the obesity one, I'd have to have a look actually, John. I don't know if our latest local figures are out and how they correspond with national. I mean, generally, we tend to be a bit better than national average, but it's in the context of when you've got 2/3 of the adult population overweight or obese. No one's in a good position, is it? But if you note it as an action, I'll check the fingertips data and get back to you. Well, if I did, should I have said trigger warning at that point?
I think it shows the vast array of work being done in partnership at Place. And it also, I would like to say a big thank you. Thank you to all the partners, but especially the voluntary organisations who are doing this, you know, to help their communities, and without them we wouldn't be able to do half the work we're doing. So big thank you for them as well. So we're asked to approve the draft content of the annual report, that the board acknowledge the commitment from partners in delivering the strategic objectives through the different projects and initiatives, and that the board agree the approach put forward to promote and raise awareness of the annual report. Are we all happy with those? Yeah, thank you. Thank you, Victoria. So we have dates of future meetings for 2025 in the agenda. Can I ask board members to note them, please? And meeting invites will be sent forward over the next few days. Item 14, any other items which the Chairman decided to take as urgent? I have no urgent items, so that concludes the meeting, and thank you all for attending. It's been a good meeting again. Thanks.